Well, Jay, I don't want to just say thank you for being here. I want to say thank you because there is nobody in America who's taken more virtual bullets than you have to fight for all of us to do something really important that helped so many people. Obviously, we were fighting the same fight, standing with you, and there's a lot we could talk all day about that fight. But I just want to ask you on a personal level, like, how are you?
Thank you, Avik. It's absolutely a pleasure to be here. It's been much more challenging than I ever would have imagined 3 years ago. I've lost friends. I'm sure this happened to many of you in the past, but I'm not used to losing friends. I never wrote an op-ed before March 2020. I'm not used to being. I'm just a professor. I write papers for a living, and my world is just completely overturned. But on the other hand, I've met so many interesting people, and had so many opportunities to participate in health policy, which is what I do for a living, and so that's been quite rewarding.
Tell us the best story, the happiest story from all this.
Well, I mean, there's so many happy stories, but probably the most moving was I got to give there was a round table that Governor DeSantis organized sometime last year. He called it "Lifting the Curtain on COVID Theater," and there was a doctor from Louisiana who had been a very strong advocate of lockdowns early in the pandemic. And at that round table, there was me, Martin Kulldorff, and Sunetra Gupta, the three of us who wrote the Great Barrington Declaration. And he apologized in public for his stances. I don't know what he was. Honestly, it just moved me just to hear it. I mean, I don't think we really need apologies. What we need is an honest conversation about what went wrong, so we don't ever do it again. But that was, like, from a personal perspective, quite moving.
I bet. So Jay, you and I have known each other for literally my entire career as a health policy person because that's what you do. Actually, before you became a famous COVID villain or hero, depending on your point of view, that's what you did. You were one of the leaders in the free market healthcare reform movement, and we interacted a lot in that capacity. And healthcare policy is a little bit one common element for me in this conversation between our previous friendship as the health policy people and the COVID stuff is the role of expertise. There are lots of experts in healthcare reform who always seem to manage to get health policy wrong. There were a lot of experts in COVID telling us what to do who managed to get things wrong. You are a professor at Stanford. You are, in theory, one of those experts. I mean in theory in the sense that you obviously are, but so much of how an expert gets defined is, well, a reporter says, well, these 5 people who I agree with, I'm going to call them the experts, and everyone else is against science. So I don't know. I don't want to put the words in your mouth, but what is that experience like? You're a guy who's, you were doing seroprevalence studies very early on in the pandemic. You were trying to contribute to our understanding of the seriousness of the COVID threat. What happened?
Well, I think. At this point in my life, I think expert is a dirty word. I don't think that we ought to give any trust to expertise whatsoever. If you look at what's happened during COVID, essentially a very narrow group of experts hijacked the conversation. I'll just give you an example of this. When we wrote the Great Barrington Declaration, we wrote it on October 4th, 2020. We're calling for lifting lockdowns and focused protection of vulnerable people. 4 days after we wrote it, it turns out from FOIA emails, Francis Collins, the head of the National Institute of Health, who sits on a pile of $45 billion of money, that controls not just the work of biomedical scientists, but also the social status, the professional status of biomedical status. I don't get tenure at Stanford unless I get an NIH grant. He writes an email calling me, Martin Kulldorff, and Sunetra Gupta fringe epidemiologists. I had someone made me a card. Says fringe epidemiology. Anyway, with some
That's okay. I like that.
And then he calls for a devastating published takedown of the premises of the declaration. And then I started getting death threats. I started getting calls from reporters asking why I wanted to let the virus rip, why I wanted to kill grandma. The problem was that there was never a consensus in favor of lockdowns. There was never a consensus, not even in March 2020. There was never a consensus. What happened was that a narrow group of experts used their power to create this illusion of consensus, to shut down debate, to make it sound as if it was anathema to even question them. It was absolutely, for me, shocking to watch it happen in real time. And I think the American people and the people of the world were poorly served by this group of experts. Because if instead we'd had a discussion, we'd had an open debate, I think I would have taken brickbats no matter what. But the debate would have shattered the illusion of consensus. Just the existence of the debate would have shattered the illusion of consensus, and we would have had healthier policy. Maybe the schools would have stayed open. So that means to me that this sort of cult of expertise, what we've done is created a scientific clerisy that sits on high, that can decide matters of public policy without discussion, without debate, where you can't even really criticize them without facing tremendous backlash. That's deeply unhealthy, and I don't see how it's compatible with liberal democratic norms.
It's crazy, my dad was a scientist. I spent my whole life in science. I majored in molecular biology at MIT. Science for us was, what I was always raised on was science means you question the received wisdom. Science is always about challenging the conventional wisdom. And all of a sudden we're in this world where to be pro-science means you cannot challenge the conventional wisdom, that somehow you're anti-science if you do the thing that science has always taught us to do for hundreds of years since the Enlightenment. I'm thinking of a story, I'll share a story that's not a heartwarming story, but an interesting story that relates to what you just said, which is, we published our big paper on reopening the economy in April of 2020. Then because there was a lot of demand, we published the follow-on paper on reopening schools in August of 2020 that my team, Dan Lips, Preston Cooper, a bunch of the people who are here were involved in. We roll out the paper. There happened to be a Zoom, because nothing was in person in those days, a Zoom kind of Jedi Council of Health Policy Nerds event right around that same time. So I did a slide deck, presented our results, showing that school reopenings everywhere around the world worked without outbreaks, literally every single case, and that we could reopen schools here. And then the guy who presented after me, and I'm not allowed to say his name because it was Chatham House rules, but he's a guy who is now a senior COVID official in the Biden administration. He said, Avik, you are going to be responsible for the deaths of hundreds of thousands of children. I hope you know that. I hope everyone in this room knows that FREOP and the work they're doing is going to result in the deaths of hundreds of thousands of children. You should be ashamed of yourself. And I'm like, that's interesting. All I can do is show you the data, which says the opposite, but you do you. And now that same individual, because that was in a confidential Chatham House setting, that same individual saying, I was in favor of reopening schools the whole time. So a lot of it is, the people, part of it is that if you have the debate, there's disagreement, and that leads to healthier policy. But what we're seeing right now is people don't even want to be accountable for the positions they had. It's like, oh yeah, even though I was completely wrong, they don't want to have accountability for the fact that they were wrong.
So there's something actually happy about that, right? So what is it, La Rochefoucauld, he's a French moralist. He has said that hypocrisy is the homage that vice pays to virtue. So you have somebody who's now saying that he never was in favor of closing schools. Of course, everyone on earth was in favor of closing schools. No one has any idea how they closed, how the schools actually got closed. That is actually a good thing, right? What we want is systems in place to make those kinds of decisions so much more difficult in the future. And if you can't find anyone to defend it, I'm much less interested in placing blame than I am in reform of systems so that we actually can't have this happen again. I want to make lockdown a dirty word so that we kind of even think about it. Because it's hard for me to envision a situation where a society-wide lockdown for any extended period of time is the right response to a respiratory viral pandemic. It should never have been the right response. We should have stuck with the old pandemic plan. I think if we have that honest conversation, I think most of the people that were in favor of the lockdowns will go away quietly, and we won't ever hear from them again on this topic, which is actually a really good thing. I'm not interested in Nuremberg 2.0. I think that's actually quite counterproductive. I think what's needed is a honest conversation about what we're wrong. And then the reform of systems should also include a reform that makes conversation among experts and among non-experts reasonable and possible. No more government interference in social media conversations, right? So what you have is a government, both during the Trump administration and especially ramped up during the Biden administration, where you have an effective ministry of truth. Like what they have is a dozen or more of like, you know, I keep saying Ministry of Truth, but you know, regulatory bodies, including in HHS, at CDC, you know, the NIH, and elsewhere, even DHS, participated in a scheme to suppress the conversation about COVID. They communicated directly with social media companies to say what to suppress, who to suppress in many cases, and they cooperated closely with mainstream media outlets in order to put out a picture, a propaganda-like picture of what COVID consensus was that never actually existed. We have to make sure that those kinds of bright lines, which seem to me like very clear violations, if not the letter of the First Amendment, certainly the spirit of it, where you have you know, government interference in the free exercise of speech, we should make sure that those things never happen again.
We have Joe Lonsdale coming on after you, so we'll talk a lot about the tech platform stuff with him. But are you seeing, so you're expressing a hope that, hey, I hope that the thing we learned from this pandemic is not the recriminations, but let's at least know that enforced consensus didn't work. Let's have a more open debate. Are you seeing at Stanford or in any of the other circles more recognition that that's important?
Not at Stanford. I mean, I think academic freedom's dead at Stanford. You know, the leadership of the major universities failed during the pandemic. They did not create platforms where reasonable debate could take place. I mean, there were some bright lights. At this conference, I met Jeffrey Flyer, who tried to make that happen. His former.
He sure did.
Yeah. But as a general matter, the leadership of major universities created hostile work environments for anyone who was opposed to the COVID consensus, the COVID supposed consensus. I mean, I felt the pointy end of that, but some of my friends and colleagues, people like John Ioannidis, people like Mike Levitt, and many, many others around the country, even outside of Stanford, faced, I mean, there's just no other way to describe it, a tremendously difficult, hostile work environment where every single tool that was possibly used, even for tenured professors, to try to stop you from speaking were used. And you know, incredibly, I mean, just things I couldn't imagine that people would do at the leadership of the universities by not platforming an honest discussion allowed to happen.
How many people with health policy or epidemiology or scientific backgrounds at Stanford do you know that came up to you and said, hey, I'm totally with you, but I'm going to keep my mouth shut because I don't want to get hassled?
I got emails from almost the first moment I started talking about COVID from around the university saying, thanks for speaking up, Jay, but I can't, if I speak up, I'm afraid I'll lose my job. I mean, a lot of people without tenure, a lot of people with clinical appointments. It was tough even for people with tenure to speak up.
Because they're afraid they won't get their grants renewed, and then
yeah. Well, I mean,
they won't get their papers published.
You have Tony Fauci and Francis Collins, who sit on top of $45 billion of funding a year. Stanford gets hundreds of millions of dollars from NIH funding. Your career depends on getting NIH funding, and that depends on review panels looking at your work, as if you're not some crazy person. It's really difficult to say, I don't think this is a good idea on a topic like this, because you're on the other side of these very, very powerful bureaucracies. We need to break up that bureaucracy, by the way. I don't think it should be the case where we create a scientific clerisy with one, essentially, effectively a pope who can decide who gets to speak, who gets money. We'd have like maybe 6 or 7 regional NIHs. So if you have one Tony Fauci, you'll have 7 to compete with them.
That's a really interesting idea. I'm taking mental notes of that. We've talked about the importance of dissent and debate. Why is it, though, that the enforced consensus, the leaders, the people who in theory know the most about virus biology, Tony Fauci, that's literally his expertise, is virus biology. Why is it that they got it wrong? Like, if one might naively believe that if you spent your whole life doing scientific research in a particular area, you might actually know something about it. So why is it that they got the policy so wrong?
I have two answers to that. One I think just purely, sort of it's a crisis in the moment, and people looked to the bad example of China, right? So in fact, there are FOIA emails from January of 2020 where what was happening at the NIH and the CDC was there was a WHO mission to China to see how they had managed the pandemic in January of 2020. And remember, China was a total mess. Wuhan was locked down, but by the end of January, it looked like China had conquered the disease. And one of Tony Fauci's main aides, Cliff Lane, they worked really hard to make sure that he got on the World Health Organization mission to China. He came back, wrote a paper, a report with a WHO person named Maria Van Kerkhove, one of the chief epidemiologists there. And he wrote an email to some folks at the NIH saying, look, what looked like what China did worked. We have a very difficult decision to make. It's going to take more than just the people in this room to make that decision. So I think the example of China and the counterexample of Italy, where there was, early February, there was this massive outbreak and their hospital systems were overwhelmed, absolutely were overwhelmed. That panicked our health policy leaders. So that's one. The other thing, I think a lot of the thinking around COVID was conditioned weirdly by our experience in the last several decades with HIV. Most of the infectious disease policy leaders in this country, and that includes Tony Fauci, that includes Deborah Birx, that includes Robert Redfield, Rochelle Walensky, you name them, they came up through the ranks because of their work on HIV. HIV was, before COVID, the major infectious disease threat in the United States. Every single instinct that they had, I think, was conditioned by the response to HIV. In HIV, after you get HIV, there is no immunity. In fact, your immune system is destroyed. Well, remember in the early days of COVID, it was basically illegal to even think that you might get immunity after COVID? Why was that? COVID's a coronavirus. Other coronaviruses produce some degree of immunity. Shouldn't that have been the norm of thinking? With HIV, all of the harms from HIV are long HIV. AIDS is long HIV. Are most of the harms from COVID, are they long COVID, or are they mostly what happens in the quick immediate period? For HIV, almost all of the spread of HIV is asymptomatic. You don't know who gave it. There's no physical presence of HIV that you know that you can see you get it. You control HIV by contact tracing. You know exactly, pretty much who you likely have gotten it from. All of these instincts were inappropriately applied, I think, to COVID. And the policies that we followed as a result were a disaster as a result because there was no chance of any of those policies actually making sense given the biology and the epidemiology of COVID.
Yeah, one thing that you're highlighting that has a kind of a general lesson in it that's not just about COVID is sometimes it's not that we didn't have plans for a pandemic. We did have a plan. The George W. Bush administration developed a whole plan. They were worried about influenza, right? An influenza variant. There were plans to deal with the pandemic. The problem was they were based on a different virus with a different mechanism of transmission and virology and all that stuff, so that if you apply that plan sort of one size fits all onto the COVID situation, it was a total disaster.
Yeah, I think the plans mostly were for viral influenza, but many of the more prominent plans weren't so bad for viral influenza, right? So like the old way we manage these respiratory virus pandemics is identify who's vulnerable and move resources to protect them. Develop quickly as we can treatments and vaccines. Do not disrupt the lives of the rest of the population because that is going to lead to vastly more harm than good to them and to others. And may even reduce our ability to manage the pandemic. Don't spread panic and fear. Instead, convey calm to the public. All of those aspects of our previous pandemic plans were entirely violated, and in some ways deeply unethically. Like in the UK, there was an explicit propaganda campaign adopted by the government to scare the public. In Canada, the military used its propaganda tools to scare the public. I haven't seen like official things in the U.S. that happened, but we all saw people like Tony Fauci get in front of Congress and scare the living daylights about parents for their kids, even though the vast amount of evidence was that this disease, thank God, doesn't really harm kids quite so much as for instance, school closures did.
I got to ask you, you advised both the Trump administration and the DeSantis administration on COVID policy. We are in a situation now where we might have Mr. Trump and Mr. DeSantis running against each other for the nomination in 24. Who do you think did a better job on COVID policy?
I mean, I'm not a political person, as you know.
Tell the truth. You're a truth teller.
But I have to say, I'll just tell you my experience with Governor DeSantis. I mean, it was September of 2020. I'd never talked with a sitting governor before, so this was an amazing thing. I was sitting in my house trying to get a little bit of rest. It was like Sunday, and this number from Florida shows up on my cell phone. It's like Governor DeSantis says, the governor of Florida would like to talk to you. I'm like, okay. I'm like, and so for 2 hours we talked about COVID and we talked about COVID policy, but we also talked about COVID epidemiology. And the guy had read a bunch of papers. He'd not just read my papers, but other papers, prominent papers on COVID. I mean, I didn't think governors knew how to read papers. I mean, that was not a thing. I was tremendously impressed.
These are pretty technical papers.
Some of them, I mean, like, you know, and then afterwards, he had a round table through YouTube or you know, through Zoom, where me, Martin Kulldorff, Mike Levitt, who's a Stanford Nobel Prize winner, he just quizzed us in front of a whole bunch of press for 2 hours. Again, he led the discussion. Then the press asked us some questions, and the next day he officially fully opened Florida. I mean, that seemed like a really nice example of leadership. A few months later, I got to interview him. You can look at the interview I put it on my YouTube channel. I have a YouTube channel, you guys. So it just has 2 interviews on it. One with Governor DeSantis, where he apologized for closing Florida in April, or in March. I mean, it's just a remarkable example of leadership, I think.
Okay, so I'll take that as DeSantis is the man. Even that's not what I'm going to put those words in your mouth. You can diplomatically deflect it.
I have a lot of admiration for him.
Why don't we take a question or two from the audience? I'll repeat the questions so we don't have mics. Go ahead.
Oh, yelling?
Yeah, yell it and I'll repeat it.
Oh, okay.
Yeah, go ahead. Oh, we do have a mic coming, so you can use the mic. Go ahead.
Hi, I'm Jacob Rich. I'm an epidemiology PhD student at the Cleveland Clinic and a scholar at Reason Foundation. I just want your comments briefly on how to navigate the COVID literature. MMWR published a piece saying that the vaccine was 5 times more effective than previous infection at reducing death. And that entire debate aside, that's just like a ridiculous idea. Because if the vaccine is 100% effective, that means that prior infection is only 20% effective. And it's not 100% effective. That basically means that it's not effective at all. But it's published in the MMWR, maybe the most prestigious academic publication for health in the entire world. So, like, how do we navigate this?
I mean, there's no shortcut for actually reading the papers with a critical eye, and some of these things are quite technical, right? As you know, as in epidemiology, so it does take some expertise. You have to allow, especially for regular people who don't have that expertise, you have to allow people to disagree with each other. And then make up your mind. I mean, I think what happened during the pandemic is like everyone found their favorite expert to trust. I find that deeply uncomfortable, actually. You know, I read that paper and I thought it was a ridiculous paper. The methods were terrible compared to, for instance, a paper out of Israel where they matched cohorts of people, tracked them over time. You know, people who weren't vaccinated who recovered from COVID, people who were vaccinated but never had COVID, and they tracked them over time. That was a much stronger design. We don't have a randomized trial for a long period over past 3 months for protection against severe disease, for instance, or transmission. I mean, we're in a world where you have no choice, if you are going to enter epidemiology, to not look at markers like, is it peer reviewed or is it published in MMWR, but just, I have to look at the data, I have to look at the methods and think about it critically. And there's always going to be ambiguity as a result of that. And the question is, how do you convey that to the public? Well, the best way is to have open discussion and debate.
Great. Next question. Let's go to the side of the room. Go ahead and shout it out and we'll get a mic to you.
I wanted to dig into your comment about the NIH and sitting on top of the pyramid. In Eisenhower's military-industrial complex, one of the things he warned against was government granting research grants because scientists would work for the grant, not for the betterment of human knowledge and so on. You're nodding, so I assume you agree with that. So given that we do have an industrial complex in medical research, what are some of the implications of that, and what could we do to turn it around?
You know, I think what's happened with the NIH over the last 3-4 decades, especially it accelerated under the leadership of Francis Collins, is it's become an incredibly conservative institution, and I don't mean that in a good way. The median age of somebody who gets their first NIH grant, a big NIH grant, in the 80s was something in like 30, 34, 35, something like that, and now it's like 45. Right, so it's older people that are getting this. So a lot of the young people who have new, challenging ideas that might overturn orthodoxy are basically drummed out of academics before they get to have this success. I did a study before the pandemic, which is I thought I'd spend the rest of my life doing, is on science policy, measuring the age of ideas in published NIH work versus non-NIH supported work. It turns out that, roughly speaking, if you wanted an NIH grant now, you should be working on ideas that are about 8 or 9 years old, whereas that was in the 1980s was like 2 or 3 years old. What we have is a bureaucracy, a science bureaucracy that is hell-bent on making sure that the social structure of science does not get challenged with new ideas. It is failing the American people. It's failing the world. It absolutely needs to change. But it can change. I am in favor of having public support of science that has positive externalities. You wouldn't normally be able to get that from the market alone. But it needs to have structures that guarantee that it doesn't just reinforce entrenched effectively cartels on ideas, so that science doesn't advance. So we should be having uprooted fundamental challenges of the idea to much more frequently within science. And the NIH could play that role, but it really hasn't.
Go ahead. Quick question.
Well, I mean, you gave the example of schools. Was the issue there really that people thought that kids were going to die, or was it that they just didn't appreciate the broader trade-offs of keeping kids away from school for so long?
I mean, I think it's both. I mean, the experts misread the evidence. Especially the ones that controlled the policy, misread the evidence through the pandemic, almost throughout the pandemic. But I think for schools in particular, I think the teachers' unions in the United States played a malign role. I think that especially that there was some sense that the teachers were uniquely at risk from getting COVID and dying, when in fact it was not true. You could look at evidence from Sweden, and Avik mentioned the report that he did. It was evidence from around the world that kids reflected the community spread of the disease rather than drove it. It wasn't like we had in our heads that, if you ever had little kids, they come home and give you every single cold known to man. You spend like 10 years sick, right? We thought, okay, the COVID is exactly like that. But it wasn't. The evidence was showing very clearly from around the world that kids did not drive the transmission, they reflected the transmission. And we didn't act on that evidence, which came out very early in the pandemic.
Well, we're out of time, I'm afraid, but Jay will be around for one of our health policy panels, his old line of work. So if you want to hear more Jay, stick around after lunch. Thank you, Jay, so much. Thanks for having me.